Good to see you all. I'm Ki Jin from Huino. Huino is concentrating on ECG technology, and we have completed developing it, and we're putting all our efforts to access the market. So usually we finished the patent right. So now we will launch our business, our product in 1 or 2 weeks. So I briefly tell you about the market. When it comes to ischemic heart disease, the ischemic heart disease account for number one for the world death rate, and followed by stroke or pulmonary disease. And if you only classify this a chronic heart disease, then it account for number one, which is categorized into hypertension, arrhythmia, heart failure, heart valve problems, or arteriosclerosis. And number one, hypertension, and number two, arrhythmia. They too account for 90% of all the heart diseases. And among them, we're currently targeting on arrhythmia. And among arrhythmia, as you can see from the statistics, the arterial fibrillation account for more than a third. And the arterial fibrillation also has a very high rate, and it has a notorious name, the silent killer. So it can lead you to stroke or a sudden cardiac death. That is because of the fibrillation, there is blood vessel issue, which blocks your lungs or your blood veins, which can occur very risky diseases. The highest risk is that you don't have any symptom. So people can't feel this, but suddenly your lungs or blood vessels will get blocked, which leads to a high chance of death. Currently, when you come up with diagnostic solutions, there would be inpatient or ECG, but if you fail to monitor it, then you conduct Holter test where you attach these patches on your chest and wait for 24 hours, like doing your living your ordinary life and monitor the ECG, and then you return the medical device to the hospital. Then they analyze the 24 hours of your activity. So that is the Holter test. So it only spans 24 hours. So from the clinical patient's perspective, it's relatively short. But you never know when the arrhythmia or other symptoms would occur. So most of the patients, even if they do have this disease, the Holter test might not successfully monitor it. So when you conduct this Holter test twice or three times, there is still a chance where they fail to monitor your disease. But if the symptoms continue, then you can choose invasive loop code with the device. This is an invasive ECG test you inject in your body, and you monitor ECG for a long term. So that has a limitation. When you take a look at the relative market, there is 12 lead ECG, exercise impact ECG, Holter ECG, event monitor ECG, and data analysis. So there are 5 different categories, and Huino is specifically targeting on Holter, event monitoring, and ECG data analysis and diagnosis. Next is Huino's technology. So we aim to go beyond the Holter ECG monitor. Like I said, arrhythmia itself is hard to monitor. You would just cough or sneeze, but you never know when this will occur. So we have to monitor for a long term. So that is the most significant factor. So if you take a look at the bodies of previous research, if you keep monitoring, the chance of monitoring a patient is 42%. when monitored for 1 or 2 days. But if you monitor for 14 days, then you can detect the disease with over 99% of chance, according to studies. In the US market, based on this, they say at least 14 days of continuous monitoring is recommended. And according to the standard guideline, they also have this 14 days rule. So when you have big data, the biggest burden is that when the number of days of monitoring gets big, then the data's volume is really high. So you need a lot of like expenses and time consumed to monitor this. So when it comes to 24 hours at Seoul National University, in order to monitor a Holter for 24 hours, you have to wait for about 18 weeks or so. If you translate this into months, then you have to wait for 5 months to conduct a 24-hour monitoring. That is because 24 hours of continued monitoring is like 2,880 pages of A4 paper when you like transcribe this monitor data. Then they have to process this data and medical staff have to process this. So processing this takes about 1 or 2 hours to analyze this data. So at least 5 staff members or up to 9 medical staff members have to work on this analyzing. But if it comes to 20 or 25 patients, only 20 to 25 patients can be processed. However, every day, like about 500 patients come here, so it's really hard to process this. But if you make use of this our solution, then you can cut down the waiting time and you can increase the efficiency. And like I said, by continuously monitoring this, you can increase the detection rate by 4 or 5 fold, and you can preemptively detect this your disease. So this strength itself has a very significant meaning that patients who have a potential to have a stroke, but they can prevent this from preemptive monitoring. Now I'll move on to our product line. The first in Korea to get approval from Ministry of Food and Drug Safety, and the first to get the medical covered reimbursement of health insurance and wearable device. And last year, we ranked number 1 in the global wearable device contest. We finished the funding, and we have accumulated investment of $80 million. And we have partnership with Yuhan Corporation, KDB Industrial Investment Bank, and NH Investment and Securities. So the NH Securities is working as our broker on this investment. So this is the first wearable medical device in Korea. So we have this history and experience. So all our medical devices, we have listed them in medically covered by medical insurance, and the first of its kind in Korea. We came up with this medical compensation. So in the past, the medical expenses, the medical coverage was 50,000 won, but we increased it by 200,000 Korean won. So this has been working from January this year, 2022. And we make use of KakaoTalk chatbot, which is the first of its kind in Korea. We synchronized this chatting bot with patients. If patients leave microdata, then the AI robot can provide information. You can interchange data remotely. So patients provide information and the medical staff receive data, and they can make a phone call to make a reservation. Back in 2019, we were designated number 1 regulatory sandbox company. So we are free from medical regulations thanks to our service model. So any business entity can use this thanks to this documentation. Last year, there was PhysioNet 2 2021. We participated in a contest where what kind of neuro system does the best monitoring, and it was sponsored by Google. And 12 lead ECG, and 3 lead and 2 lead, among others. There were 5 different categories, and Huino won in 6 lead and 4 lead. Huino won the first prize, and for 12 lead and 3 lead and 4 lead, we won the second place in 12 lead and 3 lead and 2 lead. So we have proved that our competitive power is high in the global level, and we are working hard to go public. And as I mentioned, in the end of this year or early next year, we're planning to go IPO, and then we will join the co-stock market soon. This is our team. We are equipped with the best personnel in the fields. I personally have a PhD in computer engineering, and my second concentration is HCI, human computer interaction. Based on micro technology, you can process this data at my lab. So I've been conducting this research for 2 decades, and there are other specialists as CTO, CSO, CPO. And here is the Science Advisory Board. The top 5 medical hospitals in Korea, among other specialists, are members here. And we have a very clear proposition. Patients can preemptively monitor and detect their disease. And for heart diseases, they have 5 times of higher risk of getting a stroke. So we would like to provide a better opportunity for them to monitor them. And for medical staff, they can monitor up to 20 to 25 patients a day in the past, but they can increase the number to 100. So their productivity, their efficiency will increase by a huge gap. So if they can prevent, monitor, and other heart diseases, then we will have significant benefits. So that is why we successfully got these devices included in a medical insurance list. So we're a leading company in this field, and in the future, we will work on remote monitoring and home clinic, among others, so that remote medical services can be possible in the future, and our company, will put efforts to bear fruits in this field. So that is the end of my IR. Thank you for listening.